Hello everyone and welcome to DSM-VI-DEO. You might initially think, oh, DSM-6 has come out? No, DSM-VI-DEO has come out. And it's me, Joel Edelblue, about to present to you a couple of disorders. So, first we're going to start out with the anxiety group of disorders. Maybe you can see it right here. So begin with generalized anxiety disorder. So it's abbreviated to GAD, and general anxiety and worry is what primarily defines GAD, hence the name, generalized anxiety disorder. People affected by GAD seem to have no obvious reasons for worrying, and I've heard it described as a fear of nothing. It's just this constant fear, but there's nothing to be worried about. And on a side note, I would say that I have this anxiety mildly. I often find myself just being afraid of something that I can't really place, and I don't really know why. And I have to vocalize out loud why there's nothing that I really need to be worried about. But what classifies this disorder as a disorder, as you'll probably will find as a theme throughout the rest of these disorders, is that the severity that classifies that as a disorder is that it interferes with one's life, it dominates their thinking, they're always worried, they're not able to perform daily functions or tasks, such as work, school, relationships, and the symptoms of GAD are muscle tension, ongoing worry, difficulty concentrating, and tiredness. GAD is also treated on two fronts. The treatment for it is twofold. So primarily you have medication, and then you also have cognitive behavioral therapy. And cognitive behavioral therapy is also known as CBT. I'm sure that's going to come up a lot throughout this DSM video. It includes recognizing thought patterns that lead to this anxiety and training your mind and your thoughts to see this worry more realistically. So the current research on GAD includes looking into a specific chemical that would keep stress in check apart from the flight response. So this chemical that they're looking into is called endocannabinoid, and it does sound like it's related to marijuana, and that's because it is. But it's not marijuana, and this is what you'll find a lot of people using, self-diagnosing, self-medicating really, with marijuana. But with this chemical that they might be using with further research, it doesn't have harmful chemicals like the tar and the damage that comes from smoking, and that will be associated with marijuana. Also, an increase in the level of these endocannabinoids would create this buffer for the hormones that the GAD sufferers are so harmed by. So, that's generalized anxiety disorder. All right. So we're going to begin, we'll be continuing on with panic disorder, with or without agoraphobia. So panic disorder is defined as an anxiety disorder. It's characterized by recurring panic attacks, causing a series of intense episodes of extreme anxiety during this panic attack. Symptoms include shortness of breath, chest pain or discomfort, feeling unreal or detached from your surroundings, sweating, nausea, or an upset stomach. Treatments include exposure therapy, which generally exposes the patient more and more to the thing that causes them the panic disorder in hopes that they would become more adjusted and wouldn't have such an intense reaction to the trigger. The current research finding, there's currently a lot of research being done on panic disorders. Current research on humans being able to relax, whether this be from meditation or yoga, has really shown a lot of positive improvements for patients. That was number 2. So, number 3, specific phobia. A specific phobia is any kind of anxiety disorder that amounts to an unreasonable or an irrational fear. The classics are, you got spiders, snakes, whether it's fear of public speaking, fear of being on video. These are the kind of things you can come to expect from specific fears, and they do get really specific in some instances. As a result, the affected person tends to avoid direct contact with these objects and situations, obviously, and the symptoms include feeling in imminent danger of doom, the need to escape, heart palpitations, sweat, trembling, chest pain or discomfort. Treatments include exposure therapy, cognitive therapy, relaxation techniques, as discussed before. Recent studies have really gone a long way in brain imagery and trying to figure out what it is that's exactly activating with these specific phobias. Also, cognitive behavioral therapy is used, as well as a new treatment called virtual reality exposure therapy, where you put on a headset and be immersed in the situation that you'd be afraid of, and kind of be exposed to that, as discussed before. Moving along, social anxiety disorder. That is number 4, social anxiety disorder. What is it? It's also known as a social phobia. Basically, it would be like if you take that specific phobias and just make it about being in social situations. People in these situations don't want to get into, really be around people, and they get very anxious about it. It's considered a disorder when it causes impaired functioning in one's life. Is really, you're going to see throughout all of these, that is what qualifies a disorder, is an inability to function in at least some parts of daily life. Symptoms include intense anxiety, blushing, muscle tension, upset stomach, diarrhea. Children may express this by clinging onto a parent, crying, throwing a tantrum. Treatments include a lot of antidepressants that kind of just reduce that anxiety, but also cognitive behavioral therapy is really good in actually addressing the underlying causes there. Current research findings, it was actually the last to be discovered in the phobias, at least as far as the DSM-V goes. And so, social anxiety disorder, there's some new ideas being tried, but it really has come around a lot of that cognitive behavioral therapy. Research are showing that's really kind of an effective treatment. So, yep, that's all the anxiety disorders. Thanks for watching, and we'll see you next time on DSM Video.